so from Berg's 875, what is the best way to strengthen atrophied multifidus? So, if we understand the function of the muscle, then we understand how best to challenge that muscle and recreate hypertrophy and strength. So, with multifidus, a good way to challenge it is to be an extension while resisting rotation. So that's where things like bird dogs, like McGill's bird dog progressions come in. We also have things like shoulder taps, kettlebell drags, renegade rows, and even like one of my favorites is like a bent over single arm row with a kettlebell. Those are all things, because you're trying to maintain extension against rotation, that'll help you kind of emphasize, not necessarily isolate, but emphasize the use of the multifidus and challenging it to get bigger and stronger. So just think extension with rotational stability is going to get you there. And again, bird dogs is the best place to start for most people, and then we can sort of scale your way up from there. Question from Andy Ria. What is the role of APT, PPT, so I take it you mean anterior pelvic tilt, posterior pelvic tilt, in aggravating pain from a herniating disc, and how to fix them? So if you've got a herniated disc, anterior pelvic tilt, i.e. tipping forward, going into extension, isn't going to be a problem for the disc. It could be a problem for facet joints in your muscles, especially for the facet joints if you've lost, because of that herniated disc, significant amounts of disc height, because now as you go into extension, your facet joints are going to clack together and become irritated. However, definitely posterior pelvic tilt, going into flexion is going to be a problem. So you've got to make sure that you're always constantly training your core and your posture habits, try and keep you somewhere in what we call the neutral range, so you avoid that too far one way or the other. Also, generally people that have back pain, generally have an overused back, one of the reasons is because they can't use their hips and their glutes properly, and that causes them to kind of tend to sort of stand and hold their posture in excessive anterior pelvic tilt, or I would say excessive anterior pelvic tension rather than tilt is probably a better word for it. We've just got some muscles doing a bit too much work and some muscles not doing quite enough. So rigging the glutes online, that can help manage anterior pelvic tilt a lot better, because it will just give that a little bit of relief and just tilt things back just a little bit, because the glutes are strong enough to do their job. So a question from Tom Pififififit. Just joking, something like that, I can't know how you pronounce it. Any place for lower back mobility and training in your opinion after stability, or not at all? So as always, it depends. What's your end goal? Always begin with the end in mind. Do you or your client, you actually need more mobility in your lower back? 9 times out of 10, or 9.9 times out of 10, probably not. You probably need a lot more mobility in your hips. You probably need a lot more mobility in your thoracic, probably. And between those two areas, that will kind of evenly distribute any flexion you might need to do. And the lower back only has to do a little bit of work then for a bit extra. There are real times that I can see an argument for really developing lumbar spinal flexion mobility and ability, is if like you're a gymnast or if you're like an Olympic diver, you need to get into full pike positions where your head's basically on your shins, because you need to maximize hip, thoracic and lumbar mobility to get there. But again, you know, in biology, nothing comes for free. If you specialize in excessive mobility in your lumbar spine because you need to, then you have to trade off some stability and some resiliency for bearing load and weightlifting. So you have to kind of pick your specialization, otherwise you'll get yourself into trouble. Try to chase two rabbits at the same time, you're going to get yourself into problems. Okay, question from Matt. How does calf weakness and incorporating calf raises into lower back pain and recovery? So he means basically what's the importance of doing calf raises. So this is a clinical observation from the wise and powerful Andrew Locke. It's definitely something I notice sometimes in people. Usually you'll know if it's a problem, you can almost see it. Like you'll just see people have one calf that's more developed than the other. It's quite a common thing to have with lower back issues. You could argue it's to do with things like sciatica, but also I tend to think that a lot of back issues go hand in hand with hip issues, and people tend to favour the weight onto a stronger hip, and you'll see that that calf's generally a little bit more developed, a bit more controlled. So it's not something you want to start with, like focus on right away at the start. Like you've got to prioritise what's important. So strong core, functional hips, and then you see when you get to bigger movements, things like squats and deadlifts, Or if they've got knee issues, then you have to start looking at the calf and trying to iron it out if it is causing a problem. So again, it's not something to worry about for everyone with lower back issues, but it's quite a common thing. And again, you just approach it with the appropriate priority in mind. So for most people, it's not super important to get it to straight away if they have got it. But at some point further down the line, we look at bigger movements, it'll probably start to become a bit of an issue for them. From Calve, what kind of rotational movements did you add in your training regarding back rehab? Give me some examples, please, and how do they work? Okay, that's a big ask for a second video. Anyway, right. So you're going to look at, basically, again, a lot of these questions you can answer with, just by beginning with the end in mind. What do you, or what does the client actually need to be able to do? Like, what is their back pain stopping them from doing? What are the demands of their day-to-day? What are the demands of their sport or their training? And that kind of answers those questions for you. Because you just, again, exercises are just tools. You just pick the right tools to suit the right person at the right time. So in terms of rotation, really what you're trying to do, for the most part, is you're looking at resisting rotation in the lumbar spine. Again, so we don't grind those discs down into oblivion and start causing joint problems, because you've got a very limited amount of rotation in them anyway, especially compared to your thoracic, your upper spine, and also compared to your hips. So again, generally you want to, as a general rule for most people, you want to limit the amount of work they do with the lumbar and maximize the amount of work they can do with their hips and their thoracic. So in terms of thoracic, there's plenty of mobility drills that we can do at the right time. In terms of the hips, particularly people who play things like baseball or golf, and again, if you're familiar with the work of Professor Stuart McGill, you would have seen an exercise called a hip aeroplane. And what that's designed to do, particularly in golf when people drive off from the tee, particularly that rear hip, you want them to drive through the rear hip, so you've got lots of external rotation in there, and you can drive through your glutes and your hips without collapsing into your back. And that way they'll give you maximum yardage with minimum chance of getting injured. So again, things like hip airplanes can help with that. So in terms of the core, you're generally doing stuff that resists rotation. So again, things like bird dogs are a good place to start for most people. And again, you've got things like kettlebell drag, shoulder taps, renegade rows, all those sorts of things. In terms of actually adding in rotation, it's going to be a very sport-specific thing. You've got to be very careful. Again, you don't want to rotate from the lumbar because you can start to get annular tears. You start to grind those discs down. So you be careful. It is actually coming from your thoracic and predominantly from your hips as well. And that will help you be more powerful, but also limit how much damage you're going to do to your lumbar spine. So you've got to be careful. And again, it's very person-specific. Again, most people, 9.9 times out of 10, it's not something you need to super worry about. It's just that if they do a sport with a bit of rotation, things like golf, baseball, you could argue things like boxing and stuff as well, maybe judo, you have to start opening up those hips to try and get as much power through those hips and rotation through the hips to spare the lower back. But again, if you need to get down that path, things like McGill's variation on the hip aeroplanes is a good way to really learn that skill, and he calls it steering the strength around the hips. It's a very hard exercise, but it is worthwhile. Question from Nick Madhock. Lock 5 exercise is just about good for everyone daily, or does it depend? So again, with all back issues, as you know, it always depends. So when we talk about the Lock 5, for those who don't know, this is an older video. You might have changed it since then, but it's basically we've got lock clams, a front plank, side plank, shoulder touch, and prone hip extension. So basically with the shoulder touches, the planks, and the two different planks are basically locking in front to back stability, a side to side stability, and a rotational stability. And then with the lock clams, we're getting the glutes to warm up with the basic external rotation. And then we're doing a slightly harder challenge. We're doing the prone hip extensions. We're driving the hips into the floor and getting the leg to raise through the glutes. So it's kind of covering fundamental skills. So with the people that I work with, I'll say something like, can you squeeze your glute? And they'll have no idea what I mean. So my opinion with the lock stuff, in my experience, the people that I work with, even that's too high of a skill level for most of them. I look at it as is everything's working well, and you want a solid way or a solid time-effective way just to keep things crisp and sharp, or maybe as part of your warm-up routine before you lift, I think it's a fantastic system or tool. But again, like with all tools, right tool for the right time at the right person. I have people that come in, there's no way they can do a plank. Okay, question from James Rose Bacon. How to stabilise an SI joint that pops, clicks, doesn't tolerate long duration activity. So probably number one is work out what those activities are that are causing you problems and work out if there's better ways of doing them. But we talk about sacroiliac joint stability. Things you want to look at that will help stabilise that. Number one, probably the two most important things with the glutes and the lats. So having good glute control and good lat control. So things that you can start with are things like bound pull aparts, possibly lock clams. Definitely things like glute bridges with a band as well will help. And then adding on lat control, so we can look at locks, lat pull downs or Dr. Lock's big 2 or big 3 for the upper back. We're kind of locking in that anti-shrug with the lats. And obviously exercises like the bird dog, especially level 2, where you get the opposite arm and opposite leg to work, because you're going to get that glute and that lat to work together to stabilise those SI joints. So for example, you could do like a warm up with some lock lat pull downs, get your lats locked in, do a warm up setting some banded glute bridges, and then do some bird dogs. And as you get better at bird dogs, you should find that you're getting that stability across the joint. If that doesn't solve the problem, then you might need to get more complicated. So Dr. Lock's got some cool progressions